Why is a spacer device important for children's asthma? Imagine trying to blow out a candle while holding a balloon in front of your face. It can be tricky, right? Giving asthma medicine to children can be just as challenging, especially for young kids who find it hard to coordinate inhaling and pressing the inhaler at the same time. That's where a spacer device becomes a real helper. A spacer is a clear plastic tube that connects to an inhaler. It acts like a holding chamber for the medicine. When the inhaler releases the medication, it goes into the spacer instead of directly into the mouth. For children, especially those under 5 years old, this makes a big difference because they can breathe normally through a mask or mouthpiece, and the medicine gets a chance to reach their lungs properly. When children use an inhaler without a spacer, much of the medicine can land in their mouth or throat instead of their lungs. This not only makes the medication less effective but can cause side effects like a sore throat or fungal infections in the mouth. Using a spacer helps direct the medicine straight into the lungs, where it can do its job best. This means better relief from symptoms and fewer side effects. For young children, a spacer with a mask makes treatment easier. They don't have to coordinate pressing the inhaler and inhaling at the same time. Instead, they just breathe normally through the mask, and the medication is delivered smoothly. This makes managing asthma simpler and more effective. Using a spacer also means that more medicine reaches the lungs, which helps control asthma better over time. It's as effective as a nebulizer, a machine often used in hospitals, but is more portable and easier to use at home. Regular use of a spacer with preventer inhalers can help prevent severe asthma attacks and keep symptoms under control. Parents and caregivers should always ensure the spacer is clean and in good shape. It should be replaced about once a year if used daily or sooner if damaged. After using preventer medicines, children should rinse their mouth to prevent side effects. If more than one puff is needed, wait about 30 seconds before the next dose. Also, avoid wiping the inside of the spacer dry after washing because static electricity can cause the medicine to stick to the sides. Remember, while spacers are very helpful, managing asthma should always be guided by a healthcare professional. Every child's asthma is different, and a doctor can help create the best plan for your child. If you have questions about using a spacer or managing your child's asthma, talk to your child's doctor or asthma nurse. In summary, spacers are simple but essential tools that help ensure children get the right amount of medicine into their lungs. They make treatment easier, safer, and more effective, helping children breathe better and stay active. Always follow medical advice and use spacers as directed to give your child the best chance at a healthy, active life despite asthma.